In recent times, Andrea Yates in Texas. Again, she had demonstrable issues that unfortunately resulted in loss of the lives of 5 of her children. With noted mental health professionals that have diagnosed and looked at what was going on with her, she was found, unfortunately, however we may feel about it, to be guilty with distinguishable mental infirmities. Just in recent times, now of course her case was turned over and we're talking about overturned, we're talking about legal issues, but she's going to face a new trial. But that being said, it's that kind of stigma that goes on a much smaller scale that I deal with each and every day in our courts. When I talk about mental health issues in our courts, I'm generally talking to a judge in terms of mitigating factors of why you shouldn't give a person extended time periods in jail. When you deal with the big issue in the room, no one really wants to talk about it when we come to our criminal courts, but it's a standard that is very hard to meet based upon what's been established in law: insanity. Most of your cases will not fall under the notion of quote unquote you're insane, but there are a number of other issues that come up that really don't rise to a level that can be addressed in our court system, but for the fact for me to say, hey, this person found themselves at a very young age not dealing with the stigma of their mental issue, they began using marijuana or crack cocaine or meth, and it becomes a self-medicating situation that we don't want to deal with, and then it's all lumped into one. And then when we try to deal with those issues, you have to parse them out. You have to address the addiction, but then you have to try to work to resolve and make the person whole, if you can, to get to a point where the treatment can work and so they can function. As this story began with the paper, there was a young lady that I know her family was interviewed about.